Good morning, students. Today's lecture is on epidemiology of cardiovascular diseases. These are the learning outcomes. At the end of this session, the students should be able to define and classify cardiovascular diseases, describe the magnitude of cardiovascular disease and cardiovascular disease risk factors globally and in Malaysia, describe the risk factors of cardiovascular diseases, describe the strategies to control cardiovascular diseases and risk factors of cardiovascular disease globally and in Malaysia. What are cardiovascular diseases? Cardiovascular diseases include a group of disorders of the heart and blood vessels, and they include the following: coronary heart disease, that is a disease of blood vessels supplying the heart muscles. All of us know that coronary arteries are the arteries supplying the heart muscles or myocardium. Coronary heart disease are the disease of the blood vessels, that is coronary arteries. Cerebrovascular disease, that's a disease of blood vessels supplying the brain. Peripheral arterial disease, disease of the blood vessels supplying the peripheries, that is arms and legs. Rheumatic heart disease, it's a damage to the heart muscle and heart valves due to rheumatic fever. Rheumatic fever is caused after being infected with streptococcal bacteria. Okay, rheumatic fever can lead to rheumatic heart disease that will cause damage to heart muscle and heart valves. That is known as rheumatic heart disease. Congenital heart disease. It includes malformations of heart structure existing at birth. Deep vein thrombosis and pulmonary embolism. Blood clots in the leg veins which can dislodge and move to heart and lungs. It can cause pulmonary embolism or embolic stroke also. Magnitude of the problem globally. We are discussing about the magnitude of cardiovascular diseases. Cardiovascular diseases are the #1 cause of death globally. More people die annually from cardiovascular diseases than from any other cause. Okay, now we can go through the numbers. An estimated 17.9 million people died from cardiovascular diseases in 2016, representing 31% of all global deaths. 31% of the global deaths are due to cardiovascular disease. Of these deaths, 85% are due to heart attack and stroke. Heart attack is otherwise known as myocardial infarction. Myocardial infarction and stroke contribute to 85% of cardiovascular deaths. Now continuing, magnitude of the problem globally. Over 3/4 of cardiovascular deaths take place in low and middle income countries. We always think that deaths due to cardiovascular diseases will be higher in high income countries, but actually over 3/4, that is over 75% of cardiovascular disease deaths take place in low income countries and middle income countries. That's a major concern. People cannot afford specialty care, and the facilities for specialty care is limited. So that may be the reason for increased number of cardiovascular disease deaths. Out of the 17 million premature deaths under the age of 70 due to non-communicable diseases in 2015, 82% are in low and middle income countries, and 37% of those premature deaths are caused by cardiovascular diseases. Okay, so I will explain once more. 17 million premature deaths. Premature deaths means deaths occurring under the age of 70 years are due to non-communicable diseases. 82% of those non-communicable disease deaths are in low and middle income countries, and 37% of those non-communicable disease deaths are caused by cardiovascular disease. As earlier told, among cardiovascular deaths, 85% are due to myocardial infarction and stroke. Data from the 2011 to 2013 registry in Malaysia indicated that Malaysians developed ACS. What is ACS? You know, acute coronary syndrome, at a younger age than seen in neighboring countries. Mean age, average age of acute coronary syndrome was 58.5 years in Malaysia, and the peak incidence was in 51 to 60 year age group. So acute coronary syndrome was very common and earlier in Malaysia. 58.5 years was the mean age, and a majority was in 51 to 60 year age group. This is younger than noted in Thailand. If you take Thailand, mean age for acute coronary syndrome was 63.5 years compared to Malaysia. Malaysia it is 58.5, but in Thailand it is 63.5 years. And in Singapore, median age for acute coronary syndrome is 68.3 to 69.2. Okay, so please make a note of it. Malaysia, acute coronary syndrome occur in younger age group compared to Thailand and Singapore. Information on prevalence of cardiovascular risk factors. Okay, there is a National Health and Morbidity Survey of Malaysia, NHMS survey. It showed that, okay, cardiovascular risk factors in Malaysian adult population above 18 years was as follows. 63.6% of men and 64.5% of women were either overweight or obese. You think about that. If you take 10 people, more than 6 were obese or overweight. So 62.6% of men and 64.5% of women are either overweight or obese. And about smoking. Smoking is another major risk factor. We found that 43% of men smoke. So that also very important finding. Information on the prevalence of cardiovascular risk factors locally from the National Health and Morbidity Survey. Okay, earlier we saw about overweight and obesity and smoking. Now we can look on hypercholesterolemia. 43.5% of men and 52.2% of women had hypercholesterolemia according to the NHMS survey. And 30.8% of men and 29.7% of women were having hypertension. Hypertension was a bit higher among males, while hypercholesterolemia was a bit higher among females. Then 16.7% of men and 18.3% of women had diabetes mellitus according to the latest NHMS. Okay, now we can look at the risk factors of cardiovascular diseases. The most important lifestyle or behavioral risk factors of heart disease and stroke. Okay, heart disease and stroke are the major cardiovascular diseases. We already mentioned, right? Unhealthy diet, physical inactivity, tobacco use, and a harmful use of alcohol. These are the major risk factors. Unhealthy diet, maybe high fat diet, high calorie diet, low fiber diet. Okay. Physical inactivity. Okay. Sitting more time, not moving, no physical activity. Tobacco use is one major risk factor. As already seen, tobacco use can lead to hypertension, increased blood pressure, and that is a risk factor for cardiovascular disease. Harmful use of alcohol. More amount of alcohol can lead to cardiovascular diseases. And alcohol is always linked with the tobacco use, and alcohol is linked with a high fat diet also. These all three can lead to cardiovascular diseases. Now we can look at what are the risk factors of cardiovascular disease, how these lifestyle factors or behavioral factors lead to cardiovascular disease. Already we discussed lifestyle factors such as unhealthy diet, lack of exercise, physical inactivity, and hypertension. Hypertension is also high salt diet is there, can lead to cardiovascular diseases. Smoking and abnormal use of alcohol. All these lead to metabolic effects. Raised blood pressure. Salt can lead to raised blood pressure. High fat diet can also lead to deposition of fat inside the blood vessels. Raised blood glucose. Okay, raised blood glucose, raised blood lipids, and overweight and obesity. These are the various metabolic effects. There are so many social risk factors. They are known as social, economic, and cultural risk factors, such as globalization. Globalization means world is a global village. Everyone is working together. Okay, so overwork is there. We have to work according to the demand and expectation of other countries. Okay, globalization. It adds to stress. Urbanization, more industries, more people moving away from home for work, and migration and lack of facilities and all. Okay, all these can lead to stress and cardiovascular disease. Population aging, as the birth rate is coming down and more facilities, people's age is going up, life expectancy is increasing. That also lead to more people with a hypertension and a cardiovascular illness. Other determinants of cardiovascular disease include poverty. Poverty can lead to lack of employment, and a lack of finances lead to stress. Stress and hereditary factors. Family history of cardiovascular illness, family history of hyperlipidemia, family history of hypertension. All these can lead to cardiovascular diseases. Apart from that, diabetes and hyperglycemia can lead to cardiovascular diseases. Now, we can look at the risk score. We can calculate the risk of a person to develop cardiovascular illness in 10-year period. Okay, so estimation of 10-year cardiovascular disease points for men. Okay, how we can assess the 10-year risk, using Framingham risk score for assessment of cardiovascular disease risk. Framingham risk score contains so many areas. One is age, second is level of HDL cholesterol. HDL cholesterol, that is a healthy cholesterol component. That is healthy for heart friendly. HDL cholesterol. Total cholesterol. Systolic blood pressure among non-treated individual and systolic blood pressure among treated individual. Smoking status and diabetes status. These are the 7 components of Framingham risk score: age, HDL cholesterol, total cholesterol, systolic blood pressure among non-treated individual, systolic blood pressure among treated individual, smoking status, and diabetes. Based on each score, points are given. Okay, if a person is having less than 30 to 34 years of age, that is considered as 0 point. That is more healthy. When he moves to 35 to 39 years of age, his points will be 2. And 40 to 44 points will be 5. 45 to 49 points will be 6. 50 to 54, 8 points will be given. 55 to 59, 10 points. Like that, for each age group, we will add points. Then HDL cholesterol. HDL cholesterol is high. That means more than 1.6. That means minus 2 points. Okay, minus 2 points will be reduced from that. If 1.3 to 1.6, 1 point will be reduced. 1.2 to 1.3, it will be given 0 points. 0.9 to 1.2 will be given 1 point. Less than 0.9, because HDL cholesterol is low, means it will be higher points, 2 points given. So like that, for total cholesterol values also we have to give points according to Framingham risk score. Systolic blood pressure. If a person is not treated for systolic blood pressure, he also will be given points according to the systolic blood pressure. In a treated individual also, we have to give points according to this scale. Smoker, yes, means he will get 4 points for that. Diabetes, yes, means he will get 3 points. And you have to calculate the total score for the individual. You can do Framingham risk score online also. You have to add all these values online, then they will give you total score, Framingham risk score for males. It is for males. Okay. Then based on the total score, we have to check what is the 10-year risk. Okay. If total number of points is 18 or above, that means, okay, 10-year risk is more than 30%. Okay, in next 10 years, the risk of development of cardiovascular disease is more than 30%. That is, if total Framingham risk score for man is more than 18, it is more than 30%. If it is more than 15 means, or 15 means, his risk of development of cardiovascular disease in 10 years is 21.6%. If Framingham risk score is 10 means the risk of development of cardiovascular disease in next 10 years is 9.4%. Like that we can calculate. Okay, please check that. The similar score is given for female also. Same components, age in year, HDL cholesterol value in millimoles. Okay, HDL cholesterol in millimoles per liter. Total cholesterol value in millimoles per liter. Systolic blood pressure if a person is not getting treatment, or systolic blood pressure if a person is getting treatment. Smoking, yes, means here we will add 3 points. If diabetes, yes, means we will add 4 points. Like that we can calculate Framingham risk score for females also. Then we have to look at the cardiovascular disease risk for women. If more than 21 is a Framingham risk score, the risk of development of cardiovascular disease in next 10 years will be more than 30. So for female, Framingham risk score, if it is more than 21, the risk of development of cardiovascular disease in 10-year period is more than 30%. Okay. Now, risk stratification of cardiovascular risk. Okay. So you know, very high risk, intermediate risk, and a low risk. We can classify the people as 4 categories based on Framingham risk score. Very high risk individuals are those with a Framingham risk score that confer a 10-year risk for cardiovascular disease more than 30%. So that's more than 18 for male and more than 21 score for female. That is equivalent to risk for development of cardiovascular disease more than 30%. Established cardiovascular disease, if a person already developed cardiovascular disease, that's considered as very high risk. Diabetes mellitus with proteinuria, if a person is having proteinuria along with diabetes mellitus, it is considered as very high risk. chronic kidney disease with a glomerular filtration rate less than 30 ml per minute. Okay, that's per 1.73 square meter. That is more than 4, stage 4. Okay, chronic kidney disease with a low glomerular filtration rate. That is also very high risk. High risk individual include have a Framingham risk score, cardiovascular disease score that confer 10-year risk of more than 20%. Okay, earlier it was 30%. If it is more than 20%, it is considered as high risk. Diabetes mellitus without target organ damage. No organ damage is there, but diabetes mellitus is there. Chronic kidney disease is there, but with glomerular filtration rate more than 30 and less than 60. Okay, that's a criteria. Very high level of risk factors like LDL cholesterol more, and blood pressure is more than 180/110. They are considered as high risk. Intermediate risk means have a Framingham risk score, cardiovascular disease score that confer 10-year risk for cardiovascular disease between 10 to 20%. And a low risk means Framingham risk score that confer a 10-year risk less than 10%. So that's a please keep in mind. So by looking at Framingham risk score, we can classify people into 4 categories: very high risk, intermediate risk, and a low risk individual. Okay, now we can go through how to prevent risk factors of cardiovascular disease. These are the major risk factors. Tobacco use is a major risk factor, right? So cessation of tobacco use. Then salt intake in diet. Salt, if it is more than 5 gram per day, it is high intake of salt. So yesterday's the previous lesson we saw Malaysia's average intake is 8.6 gram per day. So Malaysia is trying to reduce it to 6 gram or less per day. WHO's target is less than 5 gram per day. So reduction of salt intake in the diet, that is also a preventive strategy for cardiovascular disease. Consuming fruits and vegetables, more amount of fibers can prevent cardiovascular disease. Regular physical activity. So physical activity every day or weekly 3 days or more than 5 days. Okay, there are some recommended limit is there. Recommended guideline is there by World Health Organization. So regular physical activity is a prevention strategy for cardiovascular illness. If a person is doing exercise for 150 minutes per week, 150 minutes per week or 30 minutes a day for 5 days a week, that is considered as recommended guideline. 30 minutes a day multiplied by 5 days. So total 150 minutes per week. Avoiding harmful use of alcohol. That is also one prevention strategy. Then we understood before that diabetes, hypertension and high blood lipids are the risk factors for cardiovascular disease. So drug treatment of diabetes, drug treatment of hypertension and a drug treatment of high blood lipids. Okay, hyperlipidemia. Reduce cardiovascular risk and prevent heart attack and stroke. Okay. So now we can go through the healthy eating recommendation by Malaysia government. It is Malaysian healthy eating recommendation. A diet high in fruits, vegetables, whole grains and fish. Okay. High in fruits, vegetables, whole grains and fish. And low in salt, saturated fat and trans fat. Okay, so high in fruits, vegetable, whole grains and fish, low in salt, saturated fat and trans fat. It links to lower cardiovascular risk. So there are some recommendation, quarter, half plate recommendation is there. So quarter plate should be carbohydrate, can be rice, noodles, bread or cereals or any carbohydrate. That is quarter plate. Quarter plate should be protein. It can be fish, poultry, meat or legumes. Okay, if you are a vegetarian, you can opt legumes. Okay, if you like meat, you can take meat. If you like fish, you can take fish. So fish is a better alternative. Fish is a very healthy alternative of protein. Half of the plate, fill it with the fruits and vegetables. So quarter should be carbohydrate, quarter should be protein, can be fish, poultry, meat or legumes. Half of the plate should be fruits and vegetables. And to drink plain water instead of sugary drink. You know, in Malaysia everyone prefers sweetened drinks. So avoid that and drink plain water. Together with the following 5 key recommendations, consume 3 regular healthy meals every day. 3 regular healthy main meals every day. 1 to 2 servings of healthy snacks when necessary. Okay. At least half of your grains from whole grain and non-fried or coconut-free dishes every day, santan-free, okay, dishes every day. Home cooked food more often to avoid fast food. Fast food they add more this monosodium glutamate and more amount of trans fat. Monosodium glutamate can increase the sodium level and can lead to hypertension. Okay. Trans fat also can lead to hypercholesterolemia and other non-communicable diseases. Then remember and practice daily 8, 8, 8, 8, 8, 5, 8. What are 5, 8? Stop eating before you are full. Approximately 80%. Okay, stop eating before you are full. Have your dinner before 8 p.m. That is the second 8. Before 8 p.m. you have your dinner. Drink 8 glass of water. That is the third 8. Sleep 8 hours. Okay, it's very difficult to sleep 8 hours, but that's a healthy habit. Sleep 8 hours. Walk at least 8,000 steps. Okay, 8,000 steps a day. 10,000 steps are better. So, you know, stop your food when you are 80% full. Okay, have your dinner before 8 p.m. Drink 8 glasses of water. Sleep 8 hours and walk at least 8,000 steps a day. These are the Malaysian healthy eating and lifestyle recommendation. How can the burden of cardiovascular disease be reduced? Okay, very cost-effective interventions to be implemented even in low resource settings have been identified by World Health Organization for prevention and control of cardiovascular disease. Okay, 2 types of interventions are there for cardiovascular disease burden reduction. Okay, population-wide intervention and the individual level intervention. What are population-wide intervention? Okay, examples of population-wide intervention are comprehensive tobacco control policies. Okay, so first is tobacco. Tobacco can lead to hypertension and cardiovascular disease and stroke, right? So comprehensive tobacco control policies. That's the first population-wide intervention. Second one, taxation to reduce the intake of foods that are high in fat, sugar and salt. So taxation to reduce intake of food that are high in fat, sugar and salt. So taxation of fast food and unhealthy food, high salt food, high sugar food will be increased. Building walking and cycling paths to increase physical activity. So all parks will have facility for walking, facility for cycling. No other vehicles will be allowed inside, so people can safely ride cycle, safely walk. Strategies to reduce harmful use of alcohol. So alcoholic drinks will be provided only through limited outlets. Okay, and it will be restricted to some amount. Okay, like that. Providing healthy school meals to children. Okay, all the healthy meals, like already told, quarter, half. Quarter should be carbohydrate, quarter should be proteins, and half should be vegetables and fruits. Okay, and the strategy of 8, 8, 8, 8, 8, that is 80% full. We have to stop food at 80% full. Okay, then take your dinner before 8 o'clock. Okay, that's the second one. Third 8, what is that? Sleep for 8 hours. Okay, that's the third one. Fourth one, what is that? Drink 8 glasses of water. Fifth one, what is that? Minimum 8,000 steps per day. So that's a thing. These all will be implemented to school meals program also. So children will get healthy diet from school age, school time. Okay. How can the burden of cardiovascular disease be reduced? Now we saw about the population strategy, right? About tobacco, about diet, about exercise, and about alcohol use. Okay, all these are population-wide strategy. Individual strategy. At the individual level, for prevention of first heart attacks and stroke, individual healthcare intervention, okay, need to be targeted to those with a high total cardiovascular risk. Okay, based on Framingham risk score, those with a very high cardiovascular risk means risk of cardiovascular disease in next 10 years is more than 30%. High risk means the risk of cardiovascular disease is more than 20%. Then intermediate risk means between 10 to 20%, and low risk means less than 10%. Okay, cardiovascular risk, high total cardiovascular risk such as hypertension, diabetes mellitus, and hypercholesterolemia. We have to give individual treatment to control hypertension, control diabetes mellitus, and control hypercholesterolemia. Population-wide intervention is more cost-effective than individual level intervention and has the potential to substantially reduce the cardiovascular events. Okay. Population-wide approach is feasible in low resource setting, in low income countries or in medium income countries. Okay, primary care in low resource settings we can apply population-wide strategy, and can be applied by non-physician health workers and nurses, midwives, all can implement it. Okay. Population-wide strategy is more cost-effective than individual level strategy. Secondary prevention of cardiovascular disease in those with established cardiovascular disease. Treatment can help. Okay, so we have to identify those with cardiovascular disease using ECG and blood test and give treatment. Treatment is very important. What are the treatment? Aspirin. Aspirin is an antiplatelet agent. It prevents blood clot formation and thrombus formation. Okay. Beta blockers. Beta blockers are antihypertensives. It can reduce cardiac output, cardiac workload, and blood pressure. Angiotensin converting enzyme inhibitor, that also one antihypertensive drug. Angiotensin converting enzyme inhibitors can prevent further heart attack. Okay, further myocardial infarction. So aspirin, beta blockers, and angiotensin converting enzyme inhibitor. Do you know the examples of beta blocker? Beta blocker include metoprolol, atenolol and all. Propranolol, all these are beta blockers. Propranolol, metoprolol and atenolol. Okay. Angiotensin converting enzyme inhibitors include captopril, enalapril, lisinopril, all these. Statins. Statins are lipid lowering drugs. Their category is HMG-CoA reductase inhibitors. Okay, statins are HMG-CoA reductase inhibitors. What are the example? Simvastatin, atorvastatin, fluvastatin, all these. They reduce the lipids in blood. So these are the prevention of further heart attack or exacerbation of cardiovascular disease. We can prevent it. Okay, how? Aspirin, beta blocker, angiotensin converting enzyme inhibitor and statins. Statins are lipid lowering drugs. When used together with a smoking cessation, nearly 75% of recurrent vascular events may be prevented. So smoking cessation is also very important. Along with these drugs, if you add smoking cessation, you can prevent nearly 75% of vascular events. How can the burden of cardiovascular disease be reduced? By secondary prevention. Secondary prevention means early diagnosis and treatment. Other costly surgical interventions which can be used in secondary prevention to treat cardiovascular disease are coronary artery bypass graft. Okay, that's a bypass surgery. Coronary artery bypass graft is done. Balloon angioplasty. Angioplasty can be done. Valve repair and replacement can be done. And some diseases, some of the cardiovascular disease, heart transplantation can be done as a treatment. Then medical devices include pacemaker, prosthetic valves and patches for closing defects or holes in the heart. For which condition pacemaker is used? In arrhythmia or heart block. Heart block means heart is not producing the impulse for heartbeat. So in that condition, artificial pacemakers can be used. Prosthetic valve. In which condition? Valvular heart disease. Valve is damaged like mitral valve prolapse or mitral stenosis. We can use prosthetic valves. And patches for closing defect. Have you heard of ventricular septal defect or atrial septal defect? So in that condition, we can close the defect using patches. Now we can see what are the WHO response. Okay, WHO, World Health Organization, have multiple response to prevent and control cardiovascular disease and prevent and control non-communicable disease. Global Action Plan for the Prevention and Control of Non-Communicable Disease 2013 to 2020 aims to reduce the number of premature deaths from non-communicable disease by 25% by 2025. Okay, reduce the number of premature deaths from non-communicable disease by 25% by 2025. Through 9 global targets. Okay, what are there are 9 global targets are there. 2 of the global targets directly focus on preventing and controlling cardiovascular disease. Why? 85% of the non-communicable disease deaths are due to either myocardial infarction or stroke, right? So 2 of the global targets directly focus on preventing and controlling cardiovascular disease. Global Non-Communicable Disease Action Plan 6th target is 25% reduction in global prevalence of raised blood pressure. Okay, to reduce blood pressure, 25% reduction in global prevalence of hypertension. What is prevalence? Prevalence means total number of cases. Incidence means total number of new cases. Number of new cases is incident. Total number of cases is prevalence. Understood? So, sixth target of a global action plan for prevention and control of non-communicable disease is 25% reduction in global prevalence of raised blood pressure. Global prevalence of raised blood pressure in adults, how much it is? Adults aged 18 years and over was around 24.1% among males and 20.1% in females in 2015. Globally, 24.1% of males and 20.1% of females were having high blood pressure. Number of adults with a raised blood pressure increased from 594 million in 1975 to 1.13 billion in 2015. Okay, understood? So that much high the problem of hypertension is, with the increase largely in low and middle income countries. So cardiovascular disease is high in low and middle income countries. Cardiovascular disease deaths are more in low and middle income countries. Hypertension is also high, more in prevalence of hypertension is more in low and middle income countries. So now, what is the next WHO response? Reducing the incidence of hypertension by reducing harmful use of alcohol, physical inactivity, reducing physical inactivity, reducing overweight, obesity, and reducing high salt intake. Please remember, salt intake should be limited to less than 5 gram per day. 5 gram means 1 teaspoon. If you use more salt, more sodium will reach your body and it can lead to hypertension and cardiovascular disease. Early detection and cost-effective management of hypertension in order to prevent heart attacks, strokes, and other complications. Now, the last slide. Prevention of heart attacks and strokes through a population cardiovascular disease risk approach is more cost-effective than individual approach that we saw. A population-based strategy is more cost-effective than individual approach. Thank you. Thank you. Visit our YouTube channel, Public Health Research Videos, Dr. Sandeep.